There's a violent trend gripping hospitals here in Charlotte and across our region. Nurses, security guards, and other hospital staff are being assaulted by patients.
Our investigation started with multiple calls to the WBTV tip line asking for us to look into the problem. Chief investigative reporter Nick Oxner found dozens of assaults reported at 2 hospitals in just a 6-month period.
Oh, I think it's always been a problem for a long time, but it is growing.
Dennis Taylor says he's always known his 2 decades working in emergency medicine nursing has brought a risk of getting assaulted.
It's getting much worse. Having worked in an emergency department, I've certainly been on the receiving end of that.
Taylor spent years working in Charlotte before moving to a hospital in Winston-Salem. He's the immediate past president of the North Carolina Nurses Association. Taylor says a major source of the growing problem stems from an increase in psychiatric patients being held in emergency rooms for long periods of time while they wait for a bed to open up in an appropriate facility.
It's not only just the nurses, but it's also all the providers. All of them are feeling what this stress is.
It's a problem we first highlighted last fall, looking at the lack of youth mental health beds in North and South Carolina.
As every single day went by, they would come back in there and tell them the same thing. There's a bed on hold, but you can't get it yet. You're on a wait list.
Corey Jr. was waiting because there's a severe shortage of mental health beds in both states. Just 407 licensed psychiatric beds for children and adolescents reported in North Carolina, not including state-run facilities, and 629 such beds in South Carolina.
And it leads to calls like this one, where a hospital staffer at CMC Maine said she was hit in the face by a patient who'd been involuntarily committed for psychiatric treatment. WBTV requested police reports for assault calls at CMC Maine and Novant Presbyterian for a 6-month period between September and March. Out of 65 calls in that time period, all but 20 were for assaults on staff. 21 assaults at CMC Maine, 24 at Novant Presbyterian.
Do you get a sense that the hospital systems are aware of this problem and are taking steps to address the problem?
Well, I think they're starting to now.
In an email, a spokeswoman for Novant said the hospital system was not immune from the national trend of increased violence and said staff had, quote, experienced random and unprovoked actions of violence within our facilities. An Atrium spokesman also acknowledged the spike in violence and highlighted the fact that assaulting medical workers is a felony, saying, quote, we cannot and do not tolerate attacks on our teammates.
The problem with that is that now, while the staff may be reporting it, the unfortunate thing is a lot of district attorneys and their staff are not pursuing that. So until the magistrates and the DAs start actually prosecuting and bringing charges against folks, I'm not sure we as a staff feel like a whole lot is being done.
Taylor with the Nurses Association says the increase in violence could impact patient care as more nurses move to jobs that carry less risk on a daily basis.
What it is doing is driving a lot of people out of emergency nursing and moving them much more into other areas where they feel safer.
Reporting in Charlotte, Nick Oxner, WBTV, on your side.
Nick, thank you for that.